Question 1. In Texas, which state agency is responsible for regulating massage therapists and massage establishments? A. Texas Department of State Health Services, DSHS. B. Texas Medical Board, TMB. C. Texas Department of Licensing and Regulation, TDLR. D. Texas Board of Nursing, BON. Answer: C. Texas Department of Licensing and Regulation, TDLR. This question tests your knowledge of the regulatory body for massage therapy in Texas. The keyword regulating points directly to the government agency responsible for overseeing licenses and rules. In Texas, the Texas Department of Licensing and Regulation, TDLR, is the specific agency that issues licenses, establishes standards, and enforces regulations for massage therapists and establishments, ensuring public safety and professional conduct. For example, when you apply for your license or renew it, you will interact directly with the TDLR. Here's an easy way to remember it. TDLR handles many different types of licenses in Texas, and massage therapy is one of them. Question 2. What is the minimum number of hours of approved massage therapy instruction required for licensure in Texas? A. 300 hours. B. 400 hours. C. 500 hours. D. 750 hours. Answer: C. 500 hours. This question assesses your understanding of the foundational educational requirements for becoming a licensed massage therapist in Texas. The keyword minimum emphasizes the baseline requirement. To be eligible for a massage therapy license in Texas, applicants must complete at least 500 hours of instruction from an approved massage therapy school, which includes specific coursework in anatomy, physiology, and massage techniques. For instance, if you are considering attending a massage school, you would ensure their program meets or exceeds this 500-hour requirement to qualify for licensure. Remember, 500 hours is the magic number for basic entry into the profession in Texas. Question 3. A client presents with a localized infection on their arm. As a licensed massage therapist in Texas, what is the most appropriate action? A. Proceed with the massage, avoiding the infected area. B. Refer the client to a medical professional and reschedule the massage. C. Apply antiseptic cream to the infection before starting the massage. D. Massage around the infection to improve circulation and healing. Answer: B. Refer the client to a medical professional and reschedule the massage. This question evaluates your knowledge of contraindications and ethical practice, specifically regarding client safety. The keywords localized infection signal a condition that requires caution. A localized infection is a clear absolute contraindication for massage, meaning massage should not be performed to avoid spreading the infection or worsening the client's condition. The most responsible action is to explain the reason for declining the service, refer the client to a healthcare provider for proper diagnosis and treatment, and reschedule once the condition has resolved. For example, if a client has a red, swollen, and painful area, you would politely explain that massage could spread the infection and suggest they see a doctor. Always prioritize your client's health and safety above providing the service. Question 4. How often must a licensed massage therapist renew their license in Texas? A. Annually. B. Biennially, every 2 years. C. Every 3 years. D. Every 5 years. Answer: B. Biennially, every 2 years. This question tests your awareness of licensure renewal cycles for massage therapists in Texas. The phrase "how often" directly asks for the frequency of renewal. In Texas, licensed massage therapists are required to renew their licenses every 2 years, which is referred to as biennially. This regular renewal process ensures that licensees remain current with regulations and continue to meet professional standards, including completing continuing education. For example, if you obtained your license in January 2024, your first renewal would be due in January 2026. Keep in mind that biennial renewal means you'll be updating your license every other year. Question 5. What is the minimum number of continuing education, CE, hours required for renewal of a Texas massage therapy license? A. 6 hours. B. 12 hours. C. 18 hours. D. 25 hours. Answer: B. 12 hours. This question focuses on the continuing education requirements for maintaining a Texas massage therapy license. The keyword minimum indicates the baseline number of hours needed. To renew their license every 2 years, Texas licensed massage therapists must complete at least 12 hours of continuing education from approved providers, ensuring they stay current with industry best practices and new developments. For instance, these hours might include courses on ethics, sanitation, or advanced massage techniques, all contributing to professional growth. Remember, it's 12 hours to keep your skills sharp and your license active. Question 6. According to TDLR rules, what must a massage therapist do regarding client records? A. Keep records for at least 1 year. B. Keep records for at least 2 years. C. Keep records for at least 3 years. D. Keep records for at least 5 years. Answer: B. Keep records for at least 2 years. This question assesses your knowledge of specific record-keeping requirements mandated by the TDLR for massage therapists. The phrase client records and the agency TDLR are important clues. Texas regulations require licensed massage therapists to maintain client records for at least 2 years from the date of the last service. These records typically include intake forms, health histories, session notes, and any consent forms, which are crucial for client safety, legal protection, and continuity of care. For example, if a client last saw you in March 2023, their records must be retained until at least March 2025. Always keep those client records safe and accessible for at least 2 years. Question 7. A massage therapist's advertising states they can cure all back pain. This statement is considered A. Ethical and professional, if the therapist truly believes it. B. Unethical and misleading, according to TDLR advertising rules. C. Acceptable, as it attracts clients seeking pain relief. D. Only unethical if a client actually complains. Answer: B. Unethical and misleading, according to TDLR advertising rules. This question tests your understanding of ethical advertising practices for massage therapists under Texas regulations. The phrase "cure all back pain" is a strong indicator of a potential issue. TDLR rules prohibit advertising that is false, misleading, or deceptive, including making claims of a curative nature that cannot be substantiated. Massage therapy provides therapeutic benefits but does not cure medical conditions, so such a claim is unethical and violates professional standards. For instance, saying massage can alleviate or reduce back pain is appropriate, but claiming a cure crosses the line. Always ensure your advertising is truthful and accurately represents the benefits of massage therapy. Question 8. Which of the following is considered within the scope of practice for a licensed massage therapist in Texas? A. Diagnosing a client's medical condition. B. Prescribing herbal supplements for pain. C. Performing hot stone massage. D. Performing chiropractic adjustments. Answer: C. Performing hot stone massage. This question assesses your understanding of what is permissible within the scope of practice for a Texas licensed massage therapist. The key phrase "scope of practice" refers to the activities and procedures that a professional is legally allowed to perform. Diagnosing, prescribing, and performing chiropractic adjustments are activities reserved for licensed medical professionals. Hot stone massage, however, is a common and accepted modality within massage therapy, involving the application of heated stones to the body for therapeutic purposes. For example, if a client asks about a specific pain, you can suggest they see a doctor, but you can certainly offer a hot stone massage to help with muscle relaxation. Always remember your role is to provide massage, not medical diagnosis or treatment outside of massage. Question 9. What is the primary purpose of an intake form completed by a client before a massage session? A. To gather marketing data for future promotions. B. To determine the client's preferred payment method. C. To collect health information and identify contraindications. D. To record the client's favorite massage techniques. Answer: C. To collect health information and identify contraindications. This question focuses on the essential role of the intake form in ensuring client safety and effective treatment. The keyword primary purpose highlights its most important function. The intake form allows the massage therapist to gather vital health history from the client, including any medical conditions, allergies, medications, or injuries that might influence the massage session or indicate a contraindication. This information helps tailor the massage and prevent harm. For instance, if a client lists a heart condition, you know to adjust pressure and avoid certain techniques. Always use the intake form as your first line of defense and a guide to providing safe, appropriate care. Question 10. If a client exhibits signs of a contagious skin condition, e.g., ringworm, a Texas licensed massage therapist should: A. Massage around the affected area only. B. Provide the massage as scheduled, with extra sanitization. C. Decline to provide the massage and advise the client to seek medical attention. D. Suggest a deep tissue massage to help fight the infection. Answer: C. Decline to provide the massage and advise the client to seek medical attention. This question tests your knowledge of hygiene, safety, and contraindications related to contagious conditions. The keywords contagious skin condition immediately signal a serious issue. Contagious skin conditions are absolute contraindications for massage, as they pose a risk of spreading the infection to the therapist or other clients, or worsening the client's own condition. The professional and ethical action is to decline the service, explain why, and recommend they see a doctor. For example, if you notice a suspicious rash, you would politely explain that for their safety and yours, the session cannot proceed until a medical professional clears them. Client and therapist safety always come first. Never compromise when dealing with contagious conditions. Question 11. Which of the following areas requires specific draping or permission for a massage therapist to touch? A. The client's forearms. B. The client's upper back. C. The gluteal region. D. The client's scalp. Answer: C. The gluteal region. This question assesses your understanding of professional draping and boundaries, particularly sensitive areas of the body. The term specific draping or permission points to areas that require heightened modesty and clear consent. While areas like forearms, upper back, and scalp are typically covered but easily accessible, the gluteal region, buttocks, is considered a sensitive area that requires explicit consent from the client and proper draping before it can be massaged, even if it's within the scope of practice for certain therapeutic benefits. For example, if a client has piriformis syndrome, you would explain how massage to the gluteal area could help and ask for their direct permission before proceeding. Always prioritize client comfort and respect their privacy through proper draping and explicit consent, especially for sensitive areas. Question 12. A massage establishment in Texas must provide: A. A hot tub and sauna for client use. B. Separate changing rooms for male and female clients. C. Adequate lighting and ventilation. D. A full-service hair salon. Answer: C. Adequate lighting and ventilation. This question evaluates your knowledge of basic operational requirements for massage establishments in Texas. The keyword "must provide" indicates a mandatory requirement. TDLR regulations for massage establishments include specific provisions for health and safety, such as ensuring adequate lighting to perform services safely and proper ventilation to maintain a healthy environment. While other options might be desirable amenities, they are not universally mandated by TDLR for every establishment. For example, your workspace needs to be well lit enough to see what you're doing and have fresh air circulation. Remember that basic health and safety standards like proper lighting and ventilation are non-negotiable for a professional environment. Question 13. Which of the following actions by a Texas licensed massage therapist would constitute a violation of professional boundaries and ethics? A. Discussing the client's health history with another therapist for collaboration purposes, with consent. B. Referring a client to a chiropractor for a condition outside the massage therapist's scope. C. Engaging in a dual relationship with a client, such as becoming their financial advisor. D. Recommending a client receive regular massage therapy for stress reduction. Answer: C. Engaging in a dual relationship with a client, such as becoming their financial advisor. This question tests your understanding of maintaining professional boundaries and ethical conduct. The keywords "violation of professional boundaries" and "ethics" point to actions that compromise the therapeutic relationship. A dual relationship occurs when a massage therapist has a second, significantly different relationship with a client outside of the professional one, such as a business or social relationship, which can create conflicts of interest, impair professional judgment, and exploit the client. Discussing cases with consent, referring out, and recommending ongoing massage are all appropriate professional actions. For example, offering massage to a friend is one thing, but if a regular client asks you to manage their investments, that crosses a major line. Always keep your professional relationship focused solely on massage therapy to avoid ethical dilemmas. Question 14. What is the correct procedure for sanitizing massage tools and equipment that come into contact with a client's skin? A. Wipe them down with a dry cloth. B. Rinse them with water and air dry. C. Wash with soap and water, then disinfect with an EPA-registered disinfectant. D. Spray with alcohol and immediately reuse. Answer: C. Wash with soap and water, then disinfect with an EPA-registered disinfectant. This question focuses on essential sanitation and hygiene protocols for massage therapists. The phrase "sanitizing massage tools and equipment" indicates the need for a thorough disinfection process. Proper sanitation involves first cleaning the items with soap and water to remove debris, and then disinfecting them with an EPA-registered disinfectant to kill pathogens, followed by proper storage. This multi-step process is crucial to prevent the spread of infections between clients. For instance, between each client, your massage table, bolsters, and any reusable tools must be cleaned and disinfected according to this protocol. Always remember to clean first, then disinfect. It's a two-step process for safety. Question 15. A client asks a Texas licensed massage therapist to perform a service that is outside the scope of practice, such as cracking their neck. What should the therapist do? A. Perform the service, but with caution. B. Explain that the service is outside their scope of practice and refer the client to an appropriate healthcare professional. C. Tell the client they are not trained in that specific technique. D. Suggest the client learn to do it themselves at home. Answer: B. Explain that the service is outside their scope of practice and refer the client to an appropriate healthcare professional. This question assesses your ethical responsibility and understanding of professional boundaries when a client requests something beyond your expertise. The phrase "outside the scope of practice" is the critical clue. A licensed massage therapist in Texas is not trained or legally permitted to perform chiropractic adjustments or joint manipulations like cracking the neck. The correct and ethical response is to clearly state that the request falls outside your scope, explain why you cannot perform it, and responsibly refer the client to a qualified professional, such as a chiropractor. For example, if a client asks you to pop their neck, you would politely say, "I'm a massage therapist, and that's a service best performed by a chiropractor, whom I can recommend." Always know your limits and refer out when necessary. Question 16. What is the purpose of completing a client SOAP note after a massage session? A. To provide a detailed receipt for the client. B. To document the session details, observations, and plan for future sessions. C. To create a marketing database for follow-up emails. D. To share client information with other wellness professionals without consent. Answer: B. To document the session details, observations, and plan for future sessions. This question focuses on the importance and content of client documentation, specifically SOAP notes. The keyword purpose asks for the main reason behind this practice. SOAP notes, subjective, objective, assessment, plan, are a standardized method for documenting each client session, detailing what the client reported, subjective, your observations, objective, your assessment of their condition, assessment, and your plan for future sessions, plan. This systematic record-keeping ensures continuity of care, tracks client progress, and provides legal protection. For example, after a session, you note the client's feedback, what you found during palpation, how they responded to the massage, and what you plan for next time. Good notes help you provide better, more consistent care. Question 17. Which statement accurately describes the proper method for handling soiled linens in a massage establishment? A. Place them immediately into a standard laundry basket for washing later. B. Shake them out to remove debris before placing them in a hamper. C. Place them in a covered receptacle specifically designated for soiled linens. D. Leave them on the massage table until the end of the day. Answer: C. Place them in a covered receptacle specifically designated for soiled linens. This question tests your knowledge of hygiene and sanitation practices related to linen handling. The keyword soiled linens emphasizes the need for careful handling to prevent contamination. According to health and safety standards, soiled linens should be placed immediately into a covered, non-porous receptacle designated for dirty laundry, to contain potential contaminants and prevent the spread of pathogens. Shaking them out or leaving them exposed can spread germs. For example, you should have a lidded hamper or container next to your massage table for immediate disposal of used sheets and towels. Always use a covered container for soiled linens to maintain a clean and sanitary environment. Question 18. What is the ethical principle that requires a massage therapist to protect a client's personal and health information? A. Beneficence. B. Non-maleficence. C. Confidentiality. D. Justice. Answer: C. Confidentiality. This question examines a core ethical principle in massage therapy regarding client privacy. The phrase "protect a client's personal and health information" directly points to the principle of confidentiality. Confidentiality means that a massage therapist must keep all client information, including health history, treatment details, and personal data, private and not disclose it to others without the client's explicit consent or legal requirement. This builds trust and ensures a safe therapeutic environment. For example, you wouldn't discuss a client's medical conditions with your family or friends. Always uphold client confidentiality, it's a cornerstone of professional trust. Question 19. A Texas licensed massage therapist may perform all of the following except: A. Swedish massage for relaxation. B. Manual lymph drainage for swelling. C. Joint manipulation for alignment. D. Prenatal massage for expectant mothers. Answer: C. Joint manipulation for alignment. This question assesses what is explicitly not allowed within the scope of practice for a Texas massage therapist. The key word "except" signals that you are looking for the prohibited action. While Swedish massage, manual lymph drainage, MLD, and prenatal massage are all recognized and accepted modalities within massage therapy's scope, joint manipulation, like chiropractic adjustments, is specifically outside the scope of practice for licensed massage therapists in Texas. Such actions are reserved for licensed medical professionals. For example, you can help someone with tight muscles around a joint, but you cannot perform a high-velocity thrust to align it. Know your boundaries. Manipulating joints is not part of a massage therapist's role. Question 20. What is a primary consideration when choosing a lubricant, e.g., oil, lotion, for a massage session? A. The therapist's personal preference for scent. B. The cost of the lubricant. C. The client's allergies and skin sensitivities. D. The brand reputation of the lubricant. Answer: C. The client's allergies and skin sensitivities. This question highlights a crucial aspect of client safety and personalized care regarding massage lubricants. The phrase "primary consideration" indicates the most important factor. Before applying any lubricant, the therapist must always inquire about and consider the client's known allergies or skin sensitivities to avoid adverse reactions like rashes or irritation. While scent, cost, or brand might play a role in a therapist's general choices, client safety always takes precedence. For example, if a client mentions they are allergic to nuts, you would avoid using almond oil. Always put client safety first by checking for allergies before selecting a lubricant. Question 21. If a Texas massage therapist changes their mailing address, how long do they have to notify the TDLR? A. 10 days. B. 30 days. C. 60 days. D. 90 days. Answer: B. 30 days. This question tests your knowledge of administrative requirements for licensed massage therapists in Texas. The question asks how long for notification. Licensed massage therapists in Texas are required to notify the TDLR within 30 days of any change to their mailing address. This ensures that the TDLR can maintain accurate records and communicate important information regarding licensure, renewals, and regulatory updates. For example, if you move to a new apartment, you have a month to inform the TDLR so they can send your renewal notices to the correct place. Remember to update your contact information with TDLR promptly. You have 30 days. Question 22. A client informs you they have cancer and are undergoing chemotherapy. What is the most appropriate action before providing massage? A. Proceed with the massage, but use very light pressure. B. Decline the massage entirely due to the severity of the illness. C. Request a physician's release or medical clearance. D. Suggest a deep tissue massage to help with pain. Answer: C. Request a physician's release or medical clearance. This question addresses the critical need for caution and medical clearance when dealing with serious health conditions like cancer. The phrase "undergoing chemotherapy" is a major red flag indicating a compromised system. For clients with complex medical conditions, especially those undergoing active treatment like chemotherapy, it is essential to obtain a physician's release or medical clearance before proceeding with massage therapy. This ensures that massage is safe and appropriate for their specific condition and treatment protocol, as certain techniques or pressure might be contraindicated. For instance, if a client mentions cancer, you would explain that a doctor's note is needed to ensure massage won't interfere with their treatment. Always get medical clearance for clients with serious health conditions to ensure their safety. Question 23. Under TDLR rules, a massage therapist may not engage in sexual harassment of a client. This is an example of what kind of violation? A. A minor administrative oversight. B. A violation of ethical conduct and professional boundaries. C. A common misunderstanding in the industry. D. An issue only if reported by multiple clients. Answer: B. A violation of ethical conduct and professional boundaries. This question highlights a severe breach of professional conduct and ethics. The phrase sexual harassment clearly points to a gross violation. Engaging in sexual harassment is an egregious violation of both ethical conduct and professional boundaries, leading to severe disciplinary action by the TDLR, including license suspension or revocation. It is an abuse of trust and power within the therapeutic relationship and is never acceptable. For example, any inappropriate touching, comments, or advances towards a client are clear acts of sexual harassment. Always uphold the highest ethical standards and maintain strict professional boundaries. Sexual harassment is an absolute zero-tolerance violation. Question 24. What is the primary purpose of a massage therapist's professional liability insurance? A. To cover the cost of equipment replacement. B. To protect the therapist from financial loss due to malpractice claims. C. To pay for continuing education courses. D. To ensure timely license renewal. Answer: B. To protect the therapist from financial loss due to malpractice claims. This question focuses on the practical importance of professional liability insurance for massage therapists. The keyword primary purpose directs you to its main function. Professional liability insurance, also known as malpractice insurance, is designed to protect the therapist from financial loss and legal expenses in case a client alleges negligence, injury, or other harm resulting from the massage services provided. It offers crucial financial security in the event of a lawsuit or claim. For example, if a client claims injury from a session and sues, your liability insurance would help cover legal fees and any settlements. Always carry professional liability insurance to safeguard your career and finances. Question 25. Which of the following is mandatory to be displayed in a Texas massage establishment? A. The establishment's business license. B. The current Texas massage therapist license of each therapist working there. C. A price list of all services offered. D. Photos of the establishment owner. Answer: B. The current Texas massage therapist license of each therapist working there. This question tests your knowledge of mandatory public displays in a Texas massage establishment. The keyword mandatory to be displayed indicates a legal requirement. TDLR rules stipulate that the current massage therapist license of each individual practicing massage therapy at an establishment must be conspicuously displayed. This allows clients to verify that their therapist is properly licensed, promoting transparency and accountability. For example, when you work at a spa, your license should be visible in your treatment room or a central waiting area. Remember, displaying your license proudly is not just good practice, it's a rule.